Are we talking about hallucinogenic drugs?
Maybe some hallucinogenic drugs, but mostly plant medicine.
This is Be Well Now. All right, Dr. Ron Dummar, how are we doing today, sir?
I'm doing well. How are you?
I'm trying to be well.
Good.
I'm trying to do too much. I'm just trying to be.
Now, if you're in the attitude of being well, then you're definitely there.
And I'm in the right place.
Yeah.
Because this is the
So
Be Well
here you
Now
are.
podcast. Here I am. Here we are. Plant medicine. Are we talking about psilocybin, ayahuasca? It's all the rage these days.
Mm-hmm.
Rage is the wrong word, right? But so many people are talking about plant medicine, and you believe in medicine as plants, right? I mean, what is your philosophy on medicine as a natural health practitioner?
Well, ultimately, our medicine should be our food. It should be what we take in every day. We should look at everything that we're ingesting and consuming as contributing to our physiology, our physiological makeup. So that would be your medicine. We often think of medicine, especially in this country, as a catastrophic, triumphal reach to bring you back from the brink of death. And we think of that as medicine. But I would call that life-saving, which is what they get credit for sure. But in truth, medicine, and even at a significant level of saving lives and restoring health, is found in plants. And everywhere around us, I look around when I go on walks, when I'm outside, when I'm in nature, I look at the needles on the pine trees. I look at the leaves. I look at the buds. I look at the incredible amount of intricacy that goes into each plant and how it has learned to survive in nature and created a sustainable structure that is harmonious with its environment. That is life. That is living. That is sustainability right there. And if I, in my body and my approach to wellness, if I want to achieve health, wouldn't I then want to at least take pointers from someone or something that had already achieved a balanced state in the environment? And these plants are doing it. They thrive. They have so many different compounds within them, hundreds and hundreds of compounds, antioxidants, polyphenols, anthocyanidins, so many different compounds that they attract certain creatures or insects or bugs, and then others that detract or disguise themselves from being consumed. And so they've had a long history on this earth. Many thousands, if not millions of years, they've been able to create within themselves a structure that is harmonious in nature. And so what I love to do as a practitioner in natural medicine is to dive into these plants. And we have a lot of technology. We're still at the tip of the iceberg as far as the depth and the breadth of the level that plants can bless our lives.
Well, I'm a patient of yours and interested in hallucinogenics, psilocybin. Haven't partaken in these, but I'm very curious about them. And you know that this is becoming a more popular way to treat certain conditions.
Absolutely. Even mental health conditions, a lot of mental health conditions. But anciently, they've used hallucinogenic plants of all sorts, not even just for treating mental health, which they did use that for also, but for treating a variety of other ailments. We even have some modern research of a sustained use of certain hallucinogenic compounds having an impact on certain tumors and tumorigenesis. So cancerous type lesions having an impact on that. And there's a variety of different compounds in some of these plants that help with it being better utilized by the body than just a single cellular compound or a single unit that typically a medication is, or a drug, a synthetic.
Well, let's start talking about then.
So what is plant medicine ultimately, right?
Because I know with drugs, like you use them to kind of check out.
Yes, exactly.
Like smoking weed, for example, right? It's an easy way to sort of numb out, and that's effective for people who are going through a lot of hard things, but it can become a crutch.
Right. 15-minute break.
What do you mean?
It's the 15-minute smoking break.
Oh, yeah.
Right? It's like anything. It's like, oh, I need a cigarette, or I need something else. It's a way of checking out from the stress or from what is on you right now, right? What is overwhelming you currently? And we can check out from traumas, and people use certain recreational drugs. They use a variety of different, even alcohol is so commonly used to check out. And we see this displayed in our culture all the time. Well, what if there was a way that we could actually help you to check in? And what if checking in actually brought you to more of an awareness of the capacity that you have to overcome some of these, or to move through some of these challenges, and that thereby moving through them and not being consumed by them, but by moving through them, then you establish a greater peace and a greater understanding of life and a greater meaning and purpose of your life. And that's a lot of the idea behind plant medicine. I think we saw the article that the research article that I pulled up. It was like 41 million Americans above the age of 12 have actually utilized some sort of hallucinogenic drug, which, that's a pretty substantial number. And in modern times, there is a huge push towards this idea that there's something more in me. There's something more that I want to express. There's something more that I want to understand. There's a capacity here that is greater than I seem to be living in the world right now. And if I can get to a spiritually or energetically elevated plane or level, it's possible I could have a different view, almost like hiking up a mountain. If I could have a different view for a moment, could I see something different about my life and my potential and my capacity? And if I can see that and I can believe it in my heart, then I could begin to live it in my life.
And why does plant medicine like maybe ayahuasca or psilocybin, or I'm looking at this list, peyote, why does that get somebody to that place versus other things in life? Or, because I'm playing the devil's advocate, can we get there in a number of different ways? This just is like the fastest.
Yeah, well, this is, anesthetics, anesthetize. We can anesthetize people. We've studied a variety of these different medications over many, many years. But yeah, you can walk into an operating room and you can be anesthetized. The question is, are you having that experience? Like, what's happening under anesthesia? There's really no good, true research or full understanding of what's really happening. Like, where does the brain go? Where does the person go? Where does the body go? And so people have some sort of experience. They're somewhat aware of it. There's got to be some level of consciousness to the experience that they're having. And yet we don't know exactly what happens to the individual, right? As far as what's happening through this experience of being anesthetized. And this is a really important concept to begin to grapple with. But what we do know is that you can have varying levels or varying depths of anesthetization. So some people, if you've ever been if you've ever been anesthetized or had a doctor come in and try to do some sort of anesthetic on you and say, all right, are you feeling that? Some people are like, oh my gosh, they're gone with the first one. And some people, okay, we need a little bit more. We need a little bit more. We need a little bit more. And so the dose does vary sometimes for people. But what we're looking to achieve is we want consciousness. When we go through this experience, we want you to be engaged in this experience of life, right? And we want you to be able to do it and yet have a perspective to some degree to be able to stand back and be able to be somewhat of an observer without having a full attachment to everything that's happening at that moment. Okay? So it like gives you a different perspective or a different view. Okay?
Separating a little bit from yourself, your ego.
Exactly.
Whatever yourself is.
Right. Yeah. It allows you to be able to have a different view, a different perspective on what's currently happening and what the current situation is. Okay. And obviously we're not going to use the significant dose or level of therapy that would be utilized in order to anesthetize someone. But what we're going to do is to get them to a point.
You're talking about plant medicine now?
Yeah, plant medicine.
Okay.
Yep, with plant medicine. So there are fatal doses that can be achieved, right? But you have to consume the amount that we use in plant medicine, typically that are used in plant medicine. It's like you have to do 20-fold, like 20 times the typical standard dose for plant medicine that people use in order to come close to come to the fatal dose, right? So we're not anywhere close to a fatal dose. And so the reason I say that is I'm explaining how small amount that we're using. We're still having an anesthetic type effect on the body.
What does that mean?
Like, so anesthetized is what happens when, almost like going to sleep, when you're given a drug and you go to sleep and you have a surgery performed. And so we use these type of plants, have compounds in them that simulate this type of an effect as well. So psilocybin, for instance, mushrooms, which essentially is what they are. Psilocybin can help people to get to now psilocybin has been described in a variety.
You say it's psilocybin. Is that the
psilocybin?
Okay.
Yes. Am I saying silly?
You've never used any.
I've never used them. No,
You're a believer in plants.
I'm a believer in plants, and so I've studied these plants and I've studied the process. Yeah, and we run a ketamine type ritual in our office. So right now in the United States, plant medicine is, it's fringe. It's way fringe. In fact, it's not considered legal. And so I chose not to run that in my clinic. And so, but what we were seeing was in research, a significant amount of benefit that patients were having from these type of experiences that they were going through. With plant medicine and through an anesthetic medicine called ketamine. So by using these compounds, we get a patient to a certain place where they can kind of have an experience, be walked through and supported. Now, let me back up for just a second because it's so critical, and some of the difference between recreational drug use and plant medicine is that we're looking for, when we do plant medicine or when we do the ketamine process, we're creating a ritual. It's a work, and we're explaining to people as well, this is the work of life. This is the work that it's not just happening here. It's not just happening because of this medication. You're going to do the work. The medication's going to be a little assistant to you. It's going to give you a brief moment where you can step away from all of that pain and sorrow and suffering that you've been harboring and that you've been storing in your cells for all this time. You're going to be able to step away from that briefly. And that ability that these plants have to allow you to do that, give you this new perspective to be able to think and analyze things differently with the neurons of your brain. And then you begin to realize as well, because we set you up when you're actually going through the process with a support team. Could be your therapist. We encourage people to make sure they're going to therapy. And we'd love to have a therapist there, or we provide a therapist. And to have a loved one or somebody that cares for you and is going to be there to support you in this process, so that when you go through it and you've finished and now you're home or in a different environment, you have somebody that went through that with you and that supports you and that loves you, right? And that's somebody as well that's going to help you to be held accountable for the decision and the choice that you made, okay? So the difference, again, between recreational drug use, and I can't say this enough, checking out is what so many people use these even plants for sometimes, right? And that's not the intended purpose. It's not the intended purpose of life, but it's the only thing people feel like they can go to sometimes because they don't know what else to do. When you feel like you have no other option, and this is something that, well, it seems to bring you a little bit of a moment of peace, well, wouldn't you do it? Absolutely. So what we want to do is take people from that point to say, okay, now we need to change the mind frame and the mindset. The perspective has been, we need to check out. Well, we love you. We care about you. We appreciate you. You're an important part of our community, and you matter. And not just you matter to us, but you matter to you. And you're valuable and important. And so what we want to do is to take you to this space where all of us together are checked in, right? Checking into our communities, checking into ourselves, checking into our feelings, checking into our relationship. Not checking out, not running away, but engaging in the potential challenges that arise. We talked about, I think last week, did we talk about the staff and the serpent?
We did.
As a little bit in reference to medicine and medical. So when the Israelites were led out into the desert and they had that staff, they were being bitten, and a lot of them are being harmed by snakes. And so this staff was put up for them, and it was said that if they would look to the staff, the staff had the serpent on it. And the idea was if they would look to the serpent or to the staff, then they would be healed. Now, of course, there was a lot of symbolism wrapped up in there for the serpent and God overcoming the serpent, or this higher level or higher authority, right? So again, but if we can take that analogy into this plant medicine approach, we're giving you an opportunity. The idea is to give yourself an opportunity to recognize you may be brought before challenge. You may see significant trauma. You may have that experience come to you a little bit while you're somewhat anesthetized, right? And now the question is, how do we support you through that? Let's get you through this. Let's help you work through this process together so that you can, in maybe an incremental way, be able to develop the strength and the fortitude to overcome, or at least to deal with, that level of challenge and problem. And so once you've done that, then you're fortified and you leave a stronger, a more nuanced, and an elevated, spiritually you could say, or energetically elevated individual.
So I know the big thing they talked about, like Ram Dass and Timothy Leary, in the early LSD days, is like set and setting. Mm-hmm. So, I mean, you can't advocate for people to
like
use
setting
things.
for people. Mm-hmm.
Yeah, like, so I don't know, maybe just like the intention that you bring to it and like who you're around. But who's a good candidate for this? How do they do it? What would you recommend if someone's considering, hey, I want to try mushrooms, or I want to try acid or ayahuasca or ketamine, or ketamine in your clinic is something you can walk folks through, and it's a ritual, and you've got people with a support network. But a lot of people are just using it kind of in more casual situations.
Yeah.
So what should they know?
Yeah.
So just generally,
what's important to know is that psilocybin, for instance, is a mushroom. It's a fungus. It's a bacteria, right? So if you're using psilocybin, and you're doing it repeatedly, and I know mushrooms are all the craze right now too, but just it's important to recognize that you're encouraging a certain fungus or bacteria within your body as well. So it is possible to overuse psilocybin and impact the bacterial culture or the biotic species within the gut and the GI and the body. So yes, it will still have an impact neurologically for you, but you know, if that's what you're doing, you may want to vary up some of the things that you're looking into or trying. Okay. I can't say that I am an expert on plants that are hallucinogenic as far as the use of them, because like I said, I personally have not used them, but I do know a lot of their compounds, their products, and the things that the compounds that they have that make them functional for us. For instance, ayahuasca. Ayahuasca is it's really a drink traditionally, and it's made with two different plants. It's made from two different plants, and tryptamine is one of the components that is basically the major component. Carboline is the other component within it, but it's the major contributing factor that gives you the hallucinogenic type of effect when you do ayahuasca. And so these two plants coming together, and the interesting thing is that if you do just the one on its own, it can actually be somewhat detrimental to your body. But if you do them together, which is why it's combined, then there's something called monoamine oxidase. It's an enzyme, and it can be utilized, it can be activated or inhibited. So if you do it together, it has a unique effect that allows it to be taken up into the body. Whereas if you just do one separately, then it's not taken up into the body as well. And so there's synergism within the plants and within plant life in general. And we can look at that. I like to look at things as analogies, right, for life. And it's plants need each other, right? It's a synergistic thing. We all need each other. We're a community, and we all contribute. And so there are beneficial things that you can receive. You can receive benefit by taking just one, but you're not going to get a hallucinogenic effect unless you take them together. Okay, so that's a pretty interesting thing, at least for me as somebody of plant medicine, to recognize, hey, this is the science of plants. Okay, this is the science of plants. But again, what is the purpose? What is the point? Why would we be doing this? So people come to a point in their life and they've been faced with and dealing with traumas, past traumas, recent significant traumas. A patient that recently dealt with horrible divorce and has dealt with other childhood traumas, was going through our most recent course. And she had a really significant breakthrough. And her perspective, what you notice about these people, it's not like, they get up and all of a sudden they don't have that limp, right? They get up and you can see and hear in their voice the way that they're communicating, the language that they're choosing to use, that they've had a shift in their outlook on life, right? And so those individuals who maybe are in a state where they're trying to get off of medication and they're struggling to make it through that, and they're facing the turmoil and the frustration and the irritability of like, oh my gosh, is this really what life is like, right? That would be a great person. That would be a good thing for them to do. Someone who is trying to overcome addiction.
Why does a hallucinogen like ayahuasca, for example, help people who are trying to get off an addictive substance? Like, why do people with addictions use ayahuasca? Why could that be helpful?
Yeah, and I think that's a really good question, and we're still exploring that, why it is helpful, because it's a, you know, it's an experience that is, it's ethereal, right? It's an ethereal experience, and it's an ethereal result. But if you look at a lot of ailments that people deal with, and a lot of the research that is coming out now, even, and we've mentioned a little bit about the vagus nerve, and we've talked about the gut, and about how the gut and the vagus nerve are connected. There's a gut-brain axis, right? And we can see these significant links between neurology, the gut, my physiology, and the way I think and the way I feel. And literally saying I feel something it's an ethereal recognition, right? It's something that you recognize that your body symptomatically is giving witness to, right? And so we look at that and we go, wow, are these emotions that I'm having, are these feelings that I'm having? Because this is where a lot of it's generating from for people: irritation, the frustration, the depression, the anxiety, suicidal ideation. These are all things that these type of experiences have shown to be beneficial for. And the only thing that I can say is that it gives you a moment to step away from all of that pain and that suffering. It gives you a moment. I mean, imagine if you just had a moment to step away from that and to analyze what's going on. What is life all about? And that in addition to that, you had a support group. And that your focus going into that was, I want to become or learn something new about myself and about my environment, about my world. And you go into that with an intention, with a specific goal, and then you come out ultimately having had a recognition, a newness of life, which essentially is a shifting of the way you were thinking. A lot of the cultures have ideas that...
Can it rewire like synapses?
Yeah, well, yes. So
Not that I even know what that means, but I'm wondering, does it rewire your brain permanently? Or am I thinking about it in a way that a lot of people want to hear, but
I think that's
overcomplicating what is true?
No, I think it's an appropriate way of describing it, right? We often like to say, this is a chemical imbalance. There's been a lot of really good research recently that has completely obliterated that theory.
That depression is in chemical imbalance?
Correct.
Yep.
So first of all, let's start there, right? There was never really any solid evidence to suggest that these medications that we were placing people on were actually changing their physiology in a way to cure them, ultimately, of depression. There was something above it. Sometimes people would do it and it would benefit, though. It's not to say it wasn't benefiting people, right? But they would be placed on a medication and then sometimes they would change and sometimes they wouldn't. So it was really something above the chemical interactions that were happening in the brain, right? It was something much higher, much more sophisticated than that. And so, yes, can it rewire? I think that's an appropriate description, because I think that if you're able to have a new outlook on life, you're going to be utilizing your brain very differently. And so I would say yes to that. But do we have science that shows, okay, this rewires your brain, or, creates certain receptors? Like you see these pictures and these MRIs of brains of people that have been on different drugs and medications and things like that. I can't say that there's a whole lot of evidence that suggests that's occurring. And not with this experience, certainly, because people will go to South America, they'll go to other places and get involved in these tribal experiences. And these tribal experiences, which are rituals, they're helping people to basically confront their dragons, so to speak. Confront your dragon. We're your support group. We're here for you. But the level is so low as far as how much of the hallucinogenic they're actually going to get into their body, that they're able to actually be lucid still, right? They're still coherent. They can still interact. They can still communicate and make decisions and choices and say yes and no. And so, yes, I would say it changes to some degree the brain, but I think that the change happens at a higher level, more to what the level of that person we would call ourselves. And so this director...
Like as in, are you more than your brain yourself?
Correct.
So something a little more ethereal and spiritual.
Yes.
Which if you're into this, you're into it. If not, you can wholly
For
disagree,
sure.
right? Like, I know that's not going to resonate with everybody.
If
but
you think,
if you're this far into this podcast and you're interested in a psychedelic experience, you're probably at least open to that idea.
Well, and that's what you're looking for.
Yeah.
I mean, if you're into psychedelics, you're looking for one of two things. Either you're looking for a fun recreational trip, or you're looking for higher spiritual enlightenment. That's it.
That sounds pretty good.
Yeah, and that's what we want. We want spiritual enlightenment. We want a higher plane. We want to be able to function on a level that we are able to make decisions based on awareness, and not decisions based on fear, and not decisions based on pain and suffering. We want to be able to make decisions based on choice, on awareness, on love, and through peace. So that's really what this process, whether you choose to do it, in a different country and you choose to do peyote, right, or wachuma, or whatever you choose to do, or you choose to do ketamine. And you can have a place to do that here in the United States because it happens to be legal to do that.
I have a lot of other questions. I'd like to keep this reasonably to close to 30 minutes, which you've already passed. But I guess just the question is, like, could this harm me? What are the downsides? Like, people might ask, like, will I ever be the same? And I think the answer could be no, and that could be scary for some people. But, like, what are the downsides?
Yeah, so the downside is that some people have in the past that have had addictive behaviors or patterns. Some people do go around and they look for places to do trips. And that's okay, I guess, for them. That's their life path. But for me and for most people that I've been aware of that are pursuing plant medicine, especially calling it plant medicine, we may see some of those more so in ketamine sessions, but all of the people we've had so far in ketamine too have been looking for that next level. They've been looking for the higher plane. They've been looking for spiritual enlightenment. And that's what I would say. Your risk really is the addiction which you probably already have, right? And can you, I already told you one way with psilocybin that you can cause significant disruption in your body. And that's the fact that it's a mushroom, it's a fungus, right? And so it's going to have an impact differently than other things will. Like wachuma is a cactus. Peyote is a cactus plant. And so it's the processing that you get from that. And the compound mescaline that's in the cactus is what you're essentially getting out. Now, there are far more compounds that might really go into this process, but mescaline is the one that we've identified at this point that we think is the major active ingredient that gives you that hallucinogenic effect. So, yes.
I mean, physically, long term, could they damage you, mess you up for life? I mean, can you overdose on these?
Yes, you will. And I talked about the fatal doses, which essentially is usually about 20-fold or 20 times the recommended or the customary amount that is used, I think, in plant medicine. And so it's possible, yes. But I think that it would be more, if somebody's seeking that out and trying to do, and I'm not in that situation, but I think that they might first be going for harder stuff, looking for a quicker checkout. But again, think about the mentality. That, to me, that's the biggest concern. It's the underlying issue. So we talked about an overarching issue. What's the underlying issue here? The underlying issue is, do I want to check out from life or do I want to check in? Do I want to be involved in what's going on or do I want to check out? Do I want to be really integrating in my family? Do I want to be involved in their life? Do I want to understand them more? Do I want to be able to integrate with people more? Or do I want to just check out because it's too much and too overwhelming?
So there's an intention around it, which is a really important thing.
That is the foundational underlying issue. Is, again, am I going to check out or am I going to check in? And if you're going to check out, it doesn't matter how many, how little, how much. You're checking out. And you're using something that's intended for a spiritual enlightenment, but you're probably using it as to check out. And we try to screen for those things. I know that there are shamans and different things that run these as well, and they try to screen for that type of individual as well. And so I would just say to all of you, and I think a lesson for me in my life is be a person that checks in. If there's a struggle, if there's an issue, if there's a battle, if there's something going on, like, how can I be of service here? How can I be of benefit to humanity, to be a blessing, to change things? Because all of us have that. And if we check out, it's going to be suffering, and we're going to have to hide, and we're going to have to eventually, because we'll be having feelings that we should be involved, right? Or that we should be doing something, but we don't like that feeling because it's uncomfortable. So we'll either have to check out from that again, or we'll have to face it and address it and check in. And so I would encourage everyone to check in.
Check in and hopefully be well now.
Be well now.
There's plenty more to say about this, but I think it's interesting. I'm taking away a sense of checking in, intention, and the beauty that may be found in seeing a different perspective on something. When you feel it and you're in it and you want to see that different perspective, but you don't see it and feel it, it can be tough, and I could see the benefit of that. So did I just use English? I'm not sure.
Well, I was with you. So as long as we're together,
hey,
hopefully they enjoyed it.
If you have more questions, bewellnowpodcast@gmail.com. Community Health and Wellness in Heber. How can they find you online?
You can find us online, chwheber.com.
All right.
Be well now.
Be well
Namaste.
now. Namaste.